Hello everyone, let us discuss the recent exams questions. So this was the question. This is all like recall based, let me tell you. So if you find some of the choices or language a little bit different, it will be definitely different because it is all recall based. And if you think that choices are different, then please let me know, then I can again reframe the question and we can always discuss, right? But this is up to the best recall that I could get from the students, right? Like this is the first question: which muscle causes flexion, lateral rotation and abduction, right? So basically this is the sartorius muscle. We know that sartorius does the Faber action at hip joint and flexion and medial rotation at knee joint. Okay, so Faber is flexion, abduction, external rotation or lateral rotation. So A will be the answer here. A is the sartorius muscle, right? Coming on to the next question: during femoral cannulation, which nerve is blocked, or maybe catheterization or cannulation, some procedure was given. And see, if at all we are going for some anesthetic agent, we will definitely, among these choices, see the major nerve which is present near the femoral artery is femoral nerve. So we'll go for femoral nerve uh, blockade, because otherwise look at the lateral femoral cutaneous nerve, the distribution wise, and it is like it is at the superior angle of the you see the femoral triangle, and this is the nerve for the myalgia, right? And obturator nerve will be in the medial compartment, so it doesn't fit actually, right? And femoral branch of the genitofemoral nerve is nearby, that can be there, but better answer, it seems like femoral nerve should be the answer, right? Most significant feature of the clump case palsy. Clump case is like, these are all very simple, and most of the questions are repeat, and which we have been discussing in our classes. Now, most significant feature of the clump case paralysis, right? So clump case is the lower trunk injury, and when the C8 and T1 fibers are involved and intrinsic muscles of the hand is involved. Intrinsic muscle of hand involvement will lead to claw hand, and because of the T1 fiber specifically, there will be Horner's also. So answer will be B. Next question: hemibellismus is caused by which of the following? It is straightforward. We know hemibellismus is because of involvement of subthalamic nucleus. Most common nerve injured at the proximal end of the fibula. Now in the class, I always discuss the popliteal fossa. After that, before going to the leg, we always discuss that the conceptual understanding how the nerves are distributed into the different compartments of the leg, right? So we know that when we have, this is popliteal fossa, and in the popliteal fossa we have this nerve is coming, right? This nerve is a sciatic nerve. It will divide into two divisions, that is tibial and common peroneal. Common peroneal, it will wind around the neck of fibula, and after that it will divide into two divisions, superficial and deep. So basically we have now three nerves for three compartments: tibial for the posterior compartment, superficial for the lateral compartment of leg, and the deep for the anterior compartment of leg. And the common peroneal nerve, for going anteriorly, it will wind around the neck of fibula. It's very important clinical anatomy, and if the neck of fibula is torn, any fracture, then it will lead to definitely common peroneal nerve injury, right? So answer to this question will be common peroneal nerve. So there will be foot drop and loss of eversion, right? Now this question was again recalled, that one of the statement regarding the branches of the trigeminal nerve is false. So auriculotemporal nerve is a branch of the mandibular nerve. That is a true statement. It is eventually a branch, right? Because mandibular nerve itself, the trunk will divide into anterior and posterior. From the posterior division, we have one branch called as auriculotemporal, which will be reaching the parotid gland. And we have learned that auriculotemporal will carry the postganglionic fibers also, right, from the otic ganglion. And second choice, buccal nerve pierces buccinator. That's a true statement, and it will be basically piercing the buccinator, but it won't supply it, right? Supratrochlear nerve lies lateral to the supraorbital nerve is a false statement, because it lies medial to the supraorbital nerve. Lacrimal nerve supplies the skin, Yes, it will first supply the lacrimal gland, and after that it will pierce the septum and it will reach the skin also, okay? Because basically lacrimal nerve is a sensory branch only. In the lacrimal nerve, parasympathetic fiber for the lacrimation are added by the communicating branch of the zygomaticotemporal nerve, right? That pathway we have learned in the class. I hope you remember this. And among these options, C choice, supratrochlear choice is wrong. Let me show you one image here. We can see this is the lacrimal nerve here. This is the frontal nerve, which will divide into supraorbital and the supratrochlear, and the supratrochlear is the medial nerve, it's not lateral, and this is the nasociliary nerve, which is eventually giving anterior ethmoidal, posterior ethmoidal, right? Next question was based on the Trendelenburg test. I told you in the class that Trendelenburg test, cerebellum, and certain other topics also, I always keep on telling the students that these are frequently asked area. Almost all the exams you will get these questions. So Trendelenburg test, particularly if it is positive, which muscle is gone? It is gluteus medius muscle and gluteus minimus also, but the majorly gluteus medius muscle, right? Anyway, gluteus medius and minimus, they have the common nerve supply, that is superior gluteal nerve, and they have a common action. What is their action? They are powerful abductor and they are powerful medial rotator. So they are doing abduction and medial rotation. So that's why answer will be B, abductor, right? Now this question was asked in the evening shift also, but it was in a little different format. In the evening shift, the question was that in case the right-sided Trendelenburg test is positive, means right side hip is dropping when the patient is trying to keep the right foot off of the ground. In that case, left-sided nerve, which should have prevented the tilt, now the left-sided nerve is gone. And which nerve? Obviously superior gluteal nerve of the left side is affected. That is why it is not able to stop the tilt on the right side. Okay, so answer to this question will be B. These are all repeat questions. Next, subdural hemorrhage is because of which of the following vessel? Now subdural hemorrhage is because of the bridging veins, and we need to know about these most common vessels for different type of hemorrhages. This is what we have: extradural hemorrhage. This will be the arterial bleed, and the most common cause is the middle meningeal artery. And which division of the middle meningeal artery? Anterior division of the middle meningeal artery, which lies deep to the pterion, is responsible for the extradural bleed. But the subdural bleed will be venous bleed, right? And which vein is there? That is superior sagittal sinus. This bridging vein is there. You can see that bridging vein is basically responsible for the subdural hemorrhage, and this is the table which is given, and we can see extradural hemorrhage is because of the anterior division of the middle meningeal artery. Subdural hemorrhage, it will be venous bleed, that is because of the superior cerebral veins, which is bridging veins. And subarachnoid will be because of the rupture of the berry aneurysm, and this subarachnoid is always given, one word is used, thunderclap headache or worst headache of life. Okay. And intracerebral hemorrhage, it is because of the involvement of the Charcot artery, and Charcot artery is a branch of the middle cerebral artery. Next question, this book test. Okay, in the previous exam there was a question on the pen test, but this is the book test. The book test is done for the adductor pollicis. Adductor pollicis is being tested here. The patient is first, like he is instructed that he should use the adduction while holding the book. If the adductor is okay, he will be able to hold it. But if the adductor is not okay, if it is, suppose patient's adductor is not working, in that case, because he has been instructed to hold the book, he will be anyway holding the book. Instead of adduction, in that case, he will be using the flexion, leading to the Forment sign, right? So this Forment sign and book test, these are for ulnar nerve, right? Straight away, answer is ulnar nerve. Next question is jugular foramen, right? In the beginning of head and neck chapter, I take this topic, first topic, foramen of skull, and I always tell in all the exams you will get one question, right? So again, you see the trend is continuing. So we know that jugular foramen is from where 9th, 10th and 11th nerve will pass. Which of the following is lost? Taste sensation in anterior 2/3 of tongue, coda tympani, branch of facial nerve, that won't be affected, right? Taste in the posterior 1/3 of tongue, yes, 9th nerve will be affected. General sensation from the anterior 2/3 of tongue, lingual, which is a branch of trigeminal. Okay, so general sensation will also will not be affected. All motor functions are like it is by the 12th nerve, right? So basically we can say the taste in the posterior 1/3 of tongue will be affected, B, right? Taste in the anterior 2/3 is by the chorda tympani, right? So it won't be affected. This is because of the lingual nerve, that is be also not affected. This is by the 12th cranial nerve. So answer will be B. Next question, that is pterion. Pterion has been marked that which vessel lies deep to the marked area. So deep to the pterion, we have anterior division of middle meningeal artery which is present, and this anterior division of the middle meningeal artery is responsible for extradural hemorrhage, most common cause. This is the diagram you can see. This is middle meningeal artery. Its anterior division is seen at this pterion position, right? Now this nerve, which was like section of the brainstem was given, and this nerve was marked. Now marking can be different also, but this is what I got from the recall, that this nerve was marked. But anyway, let us discuss all. So here we have, this is the section. In the ventral aspect, obviously we can see the third nerve, but in the dorsal aspect we can see the fourth nerve also, right? You can see, because the fourth nerve is the only nerve which exists from the dorsal aspect. Now rest, whenever we see the cranial nerve, thickest will be the fifth nerve. So this is the trigeminal, but at the PM junction we can see sixth nerve, seventh nerve, eighth nerve, right? And then in this medulla part we have ninth nerve here, then we have the 10th nerve. This is again relatively thicker nerve, right? And we have accessory nerve, but for the accessory nerve we have two parts, spinal accessory and cranial accessory. So among these nerves which have been marked at the pontomedullary junction, if this was marked, answer should be sixth nerve. Now limbic system includes, now this is a new question because this was not asked in the recent times. So limbic system, among these options, answer will be C. A plus B plus C, means these three are included in the limbic system. Caudate nucleus is not included. So here we have limbic lobe is there where the hippocampal formation is there, so hippocampus will be involved. Along with that we have certain subcortical nuclei. Subcortical nuclei you can see here. This is the diagram, right? Hippocampus and hippocampal formation, that will be part. Along with that, amygdaloid body is there, septal region, olfactory area, hypothalamic part, particularly the mammillary bodies, and anterior nucleus of the thalamus. So these are the subcortical nuclei which are also included in the limbic system, right? So among these given option, then answer will be A plus B plus C, right? Caudate nucleus is a part of basal nuclei that is not included in the limbic system. So internal capsule has what type of fibers? Now again, this internal capsule has not been asked, but the white fibers, they have been asked previously also. So we have three type of fibers. Association fibers are those which are connecting the two areas in the same hemisphere. If they are connecting the two areas in the same hemisphere, it will be association. Commissural fibers are those which will be connecting two areas in different hemisphere, and if some structure is like at the level of cortex and it is being connected to the subcortical level, then it is called as projection fiber. So here we can say that this is the association fiber, this is the commissural fiber, and this is the projection fiber. Now association fiber, what is the example? Arcuate fasciculus. Commissural fiber, so many examples are there, and the biggest one is the corpus callosum. Projection fiber, typical example which is given in the Gray's Anatomy is internal capsule. So internal capsule is what type of fiber? Projection fiber, because in the internal capsule we have ascending and descending fibers. Those will be connecting the cortical areas with the subcortical areas, right? And fornix is one of the tissue which is having actually all three type of fibers, but in Gray's Anatomy, like fornix, in other books it has been described to have all three set of fibers, but in the Gray's Anatomy 41st edition it is given as association and commissural, means it has been described under association and under commissural, but it is not written that it is not projection fiber, but it has not been described under the projection fiber, right? But other books, they are saying that fornix is having all three set of fibers. So if the combination wise question is asked like A and C, P and A, C and P, if this type of choices are there, then better to go with A and C because it is given in grays like that. Okay. So in this question, internal capsule, projection fiber, straight away it is given in Gray's Anatomy 41st edition. Now this question, molecular layer of the cerebellum consists of. Now cerebellum histology is very important and we always study in the gross anatomy, like with the neuroanatomy only, we always study this histology, right? And molecular layer, it contains basket cell or stellate cell. So whatever choice was there in the real exam accordingly. So that is the correct answer, basket and stellate cell. Now which choice was there and what was the real language of the question, that you are the best judge. So here I can show you that we have three layers basically, molecular layer, Purkinje layer and the granular layer. Molecular layer is having basket cell and the stellate cell, and Purkinje cell is such that Purkinje layer where we have the Purkinje cell bodies, not the dendrites. Dendrites are above and the axon will come down. Axon will be basically coming down in order to communicate with the deep nuclei here. And we have two set of afferents coming. So one set of fibers which are coming from the olivary nucleus, they will travel as climbing fiber. They will reach directly up to the highest level and they will communicate with the dendrites of the Purkinje. On their way, they will also communicate with the deep nuclei. But rest all fibers, they will come together as a mass and then they will be reaching the lowest level, and from here the fibers will be indirectly being carried by the granule cells like that. Okay. So eventually Purkinje cells will get the information either directly or indirectly via this pathways, right? So that is what we need to know, and Purkinje cell after that will behave as the output cell. Now output from the cortex is the Purkinje cell, but output from the cerebellum as a whole is the deep nuclei, right? Now this question, internal iliac artery, again this is very, like you can say, common area, repeatedly asked topic. And what are the branches from the internal iliac artery? Although this question was this question was based on the posterior division, but let us learn all the branches of the internal iliac artery. So for the internal iliac artery, we have like anterior division. We have this mnemonic is there. Then the mnemonic says that Shiv obtained marks in PG. So basically we have superior vesicle, inferior vesicle, obturator artery, middle rectal artery, then in goes with P and G both. That means internal pudendal and inferior gluteal. Internal pudendal and inferior gluteal. Okay. So these are the branches basically which we need to know from the anterior division. These are the branches, right? Superior vesicle, inferior vesicle, obturator, middle rectal, internal pudendal, and the inferior gluteal artery. Now inferior vesicle, like vesicle is the word for the bladder, right? Urinary bladder. Inferior vesicle means the lower part of the bladder where prostate is there. So inferior vesicle artery in case of female is not present. Instead, it is replaced by the uterine artery and vaginal artery. Okay. But from the posterior division, we have three branches. That is superior gluteal is there, iliolumbar is there, and the lateral sacral is there. Internal pudendal will be the answer because internal pudendal is a branch from anterior division, right? It is a branch from the anterior division of the internal iliac artery. So that was this question, right? So that is all, dear students. This is a favorite quote. If you do not sacrifice for what you want becomes the sacrifice. So whatever, like however this exam was, you have learned from this exam, okay, and never give up. Now the main exam is coming, the NEET exam is coming, and be prepared, okay, give your best shot. आप अपना best दो, बाकी रब रखा, okay. Believe in yourself, believe in God, and definitely miracle will happen. My best wishes to you. God bless you all. Thank you.